I met Lisa 2 or 3 years ago at a course that FDA were running as part of our Women into Leadership development programme. She was one of a number of people there who hadn't previously been active in the union. So it's been really great to have somebody who came to a course like that, not having been active, not even really understanding how her part fits into the wider union, and to see that she's now gone on to become an activist. I guess it's what you hope and dream of happening whenever you meet and engage with a union member. To have them follow on in that way has been really wonderful.
Lisa's been absolutely key in the equalities work. We started off targeting on women members, trying to get senior women engaged. We've been working closely with Scottish Union Learning, and Lisa has been able to energetically engage, come up with new ideas as well.
So I think one of the barriers we've had originally to all of that is actually how do we get out to the membership and how do we get people involved. I think some of those early events have really helped us with that we now have people that we are all working together collectively to really sell what we can do and really build that leadership side of things. So I think for me, how I maintain that sort of energy and enthusiasm is through the results that I see in the people that we're actually able to deliver that service for and see that we're really making a difference.
So this was an excellent opportunity for us to get this learning through the union and through a professional external provider.
Where Lisa has been key is in the approach of offering mentoring sessions and direct one-to-one interactions. So we don't just do the events, we follow the events up by using the expertise of Lisa and her colleagues to interact with people, give them guidance and encouragement.
The negotiations with an employer can go so many different ways. In this particular negotiation, we were at a stage where the employer had stretched as far as possible in terms of making an offer to us.
Quite some time ago, we initially asked for equality monitoring and equality impact assessments to be done, because basically the good thing about that is it helps prevent indirect discrimination within the workplace.
Linda's one of our prospect reps. She's been involved in various union activity working with myself or with the HR team, and now our ongoing review of policies, we have implemented a procedure whereby any time we change a policy, we do an equality impact assessment.
Linda is always focused on equality, whether it's a personal case, if it's a slight renegotiation of a policy, if it's a slight change in working practices. Linda is one of those individuals who makes sure that equality is at the absolute forefront.
So it's great that she's been recognised in this way. You know, she's put a lot of effort in, both in the Institute and in her own time as well.
I get really passionate when I'm trying to speak to people and trying to impassion other people to say that this is great, this is what we should be doing, you know, and we have to have it in everything, because I truly believe that if we're ever going to have a decent world, you have to have equality underneath it all. The unions are the only ones that are really truly fighting for it at the end of the day.
I was quite surprised at the situation of the seating at the National Museum of Scotland. I was sort of upset by the lack of adequate seating for members of their staff who spend most of their time on the floor.
The seating campaign in particular has been kind of bubbling along actually for months, if not years now. It has been an ongoing issue. But the reason that the branch have been put forward for this award is because of the new tactics they're bringing to bear on this campaign.
Tactics we've used in the campaign, we had a body mapping exercise, we have used petitions, and now we are taking outside the museum because we've exhausted all internal avenues.
We created body mapping exercises for our members to do, and they strongly indicated that there was a problem for people's backs and feet.
This is a really inspiring branch. They have been member-led, it's their campaign. They've put in the work to identify where their strengths and weaknesses are, and they've been quite honest about that, but they've also put in the work to get their colleagues and co-workers on board to rally behind this cause, and I think this is going to produce results.
The union has been incredibly supportive of this campaign. We have got a lot of support from our full-time officers. They've engaged in the issue with us.
It's currently with management. We're waiting for a response on this. So once we get that response, we'll see what the next step is. But if this branch has shown one thing, it's that they can fight for the long haul. They were in the industrial dispute for almost 3 years, so they're not going to give up anytime soon.
A number of stewards in the branch work in job evaluation, and we all felt there was a case out there. Healthcare support workers who were banded at 2 were working in clinical roles, and clinical roles in the Agenda for Change are definitely band 3, and that's what we built this case on, that they should be banded appropriately for the clinical care duties that they were carrying out.
I nominated the branch for this award because I felt that they were very deserving to be recognised for all of the hard work that they've done. They used a real organising agenda to promote this campaign. This was very much steward-led and member-led.
Our campaign was well received. We increased our membership between 300 and 400 in the first 6 months of it being launched. Word soon spread amongst their colleagues basically, and people started joining us. And when we were out on the floors doing the walkabouts in the departments, it was well received by the staff who were saying, we know you're a campaigning branch, we see you here all the time, you're always informing us of things, so we want to join you.
The importance of face-to-face contact for the branch and indeed for all trade unions is invaluable. Nothing beats going out and talking to members.
Obviously the departments are very busy where the staff are working, so we would always seek permission from the senior charge nurse to allow us to speak to the staff at that time. Sometimes they were willing to do that, sometimes not, but if they were not willing, we would just camp outside the door and wait for them coming out.